Is there a real pandemic with COVID-19? Many people feel this is the same as a flu. It's not very serious. There's not many cases in Thailand. Is this a serious public health threat to Koh Phangan?
Absolutely. There may be rumours about where the virus came from. I don't know. Maybe it came from Mars, maybe it was man-made, maybe it came from the Earth. Who knows? All I can speak of are the effects it is having on the population. There are hundreds and thousands of people dying. That cannot be hype. There are people ill. The people who are most at risk are the older people, people with reduced immunities, underlying conditions. Therefore, it is targeting the weak. For people, other people who are healthy are lucky, but they must be responsible because it's not them, it's the older people who are at risk. I understand people feeling that they are not at risk by themselves, but they must remember other people.
What's the difference between this and a common flu?
The big difference, because the common flu, if you think back, even the H1N1, the bird flu, chicken flu, whatever you want to call it, that was very serious at the time. But very quickly, because there were other types of influenza around, there was a medication available called Tamiflu. And that can reduce the effects of the virus. But again, that virus is still serious in Asia and it can kill. It can be very serious. But with the COVID, there is no vaccine, there is no medication that is proven to work against it, and we're trying lots of different things, but we don't know. This is the big thing about this virus. We don't know.
If there were not all these restrictions in place, and we had thousands, tens of thousands of people coming in on ferries and full moon party and resorts and just did business as usual, and you have small number of people, 10 people come in who are infected, and maybe each of them on average infect 1.5 other people. Can you give a scenario of what might happen on this island, both in terms of overwhelming medical facilities affecting your staff, Koh Phangan Hospital and others, and affecting those who are vulnerable on this island?
The people who come in and affect other people, majority of people who come to this island, like the full moon party, they don't stay on the island for so long. So they themselves would not be much of a burden on the local community. Mm-hmm. But because the population of the island is quite small, it would mean that a lot of key people were ill and dying. The government hospital, under the regulations as they stand just now, are the only people who can treat positive cases and isolate positive cases. At the moment, they only have 3 available rooms. They are in the process of building more, but the rooms have to be what they call negative pressure rooms to keep the germs inside. And any exhalation of the air from inside has to be put through a special filter. As I say, there are 3 rooms, so if there are more than 3 people ill at any given time, the hospital can't cope. The testing is only done, the correct testing is by PCR, and that can only be done at the moment in Bangkok. It is a very, very expensive process to lay out in any hospital, and it needs a large area specifically for that one test. Nowhere, as far as I'm aware, other than Bangkok is able to do this.
Can you paint a picture if there were a significant number of infections, and do the math based on those 10 people who would come in and whatever the rate of spread of the infection might be. If you have a 26-year-old nurse working at Koh Phangan Hospital, what's the impact on that nurse for an overwhelmed hospital system?
Unbelievable, because being an island, no time do we use more nurses than we need. It's logical. Otherwise, we'd sit about all day. So there are a few nurses, and these few nurses would have to work 24 hours a day to try and cope with the type of, or the numbers of people who would be infected with this. And if you say, easier to say 1 to 2, if you think about it pro-logically, then we're looking at hundreds and not thousands of people within 3 or 4 days being infected, which would just be impossible.
Yeah.
People would be dying left, right and centre. And a lot of care people. I'm from the UK, as you can probably tell by my Scottish accent, but my son is over there, and there are over 12,000 people dead over there, as far as I'm aware. And this means there can't be hype. These people are dead. You can't make that a false accusation. It's absolutely happening. And whatever, you can fake videos of empty hospitals. There may even be empty hospitals somewhere because there's no staff to man them. Who knows? But as far as I know, everyone is scared of this virus. It kills people, and it kills people who look after the sick people.
What's your message to those who are on this island in terms of how they should behave, what they should do, attitudes towards their rights to free speech and the rights to freedom of movement? As a medical professional, what's your advice to people?
Well, put it this way. If you knew your mother would probably die of this virus, and by you wearing a mask all day would save her, what would you do? You may be right, you may be wrong, but even if you're right and it's not necessary, does it kill you to wear a mask? The answer is no. If we're right and you're wrong, and you don't wear a mask, you're going to kill the person anyway. For your own safety, if we're right and you're wrong, and you wear a mask, then it might give you some protection. If you're wrong, and if we're wrong and you're right, you don't wear a mask, you're going to get it anyway, so what's the difference if you wear a mask? Uncomfortable, but hardly a really big thing. And this is maybe for a few months.
Yeah.
Once we know what we're dealing with, and once a vaccine or medication is available, then everything changes back to normal.
Finally, any recommendations or advice you have to people individually as to how they can best communicate and share information among friends or social media, and for the island's Facebook pages like Conscious Community and others? What, in your view, is an effective, sensitive, responsible approach to take?
Well, to be honest with you, if you've been affected by COVID, if you've had any relations or friends who have been affected by COVID, by all means post and let people know how serious it is. But don't try to diminish the problems and try and get other people ill because you don't believe in them. I mean, a lot of people don't believe in God, but it doesn't hurt other people to worship God. You know, I don't believe in Martians, but if I met one, maybe I would. So why take the chance? Don't take risks for yourself or for other people.
Thank you very much for your time.
No problem. Thank you.